one woman had, between epidurals and all kinds of other stuff, she had over 20 back procedures done to her.
Right.
And her pain was almost eliminated by the end of the 8 weeks. There were people who had been in wheelchairs, been in scooters, that at the end of the 6 week or 8 week period were walking 2 miles.
Really?
Right. So I started working with people who have chronic pain back in 2009. I got my PhD in functional medicine, and functional medicine is looking for, let's look at root causes.
Okay.
So there's a lot of testing, typically like blood tests and different things like that to see, whereas physicians aren't taught to look for root causes. In fact, one told me recently there's no such thing as a root cause. Stuff just happens. And I've learned some different modalities, and I think I've stumbled upon what the direction I really want to go with. And
which is what you're doing now.
Which is what I'm doing now.
So what is it called, first of all, and basically how does it work?
Okay, so I use the term neuro reset because that seems to be the most, the closest thing to what we're doing. We start with it's a physical technique that 20, 25 years ago started out like as a chiropractic manipulation and is evolved into more of almost an acupressure type of deal.
Got it.
And so I can put somebody on my table and test them, and in about 10 minutes we'll know whether or not this technique is going to work on them.
And that I love. I was reading on your website. We're going to come back to that.
And the test is always free.
Okay.
And so
explain you say it's sort of like are there any, I'm thinking of acupuncture, but you said acupressure.
Acupressure, right.
So there's no pins.
No pins, no. I'm using either my thumbs or I have a set of tools, and the tools are proprietary and custom made for each of the practitioners who do this.
Okay.
And so, and there's a spot in here, and what we're doing is we're relieving the fluid pressure off the meninges and resetting it. And the meninges is the sheath around the spine.
Okay.
It's around the spinal cord, and it's attached to all the nerves in your body.
Okay.
And so if it's out of place, all kinds of things are going to be out of whack. You're going to have pain. There was one gentleman who he had pain in his big toe so badly that he wanted it
amputated.
He wanted it amputated. Yeah. And he still has his toes. And so my wife had all the classic symptoms of fibromyalgia. And after 8 weeks of treatment, 0 symptoms.
Really?
0 symptoms. Yeah.
And did this have something to do, because I was reading on your website, does this have something to do with your dad? Or was that like kind of a motivator?
So right now, yeah, I'm actually, my dad had a stroke 3 years ago. And I'm actually right now 6 weeks into his 8 weeks of treatment. And he's walking, but he's not dragging his feet.
Wow.
He's got more energy. He's walking faster. He's thinking more fluidly. His speech is more clear. He's having conversations with people as opposed to just answering with 1 or 2 word answers.
Really?
And he doesn't have any pain, so the pain part of it wasn't in play, but it was more of let's test him out and see if this does anything for him. And one of my colleagues, Dr. Paul in California, has had similar results with other people who've had stroke issues.
Well, first of all, tell me about your test. How do you know when you do this test, what do they experience during this test that they do?
Right, so I'm gonna lay them, first I'm gonna lay them down on their back, and then I'm gonna sit on the end of the table, and I'm going to push in and down on the spot where it is. And we're going to run that about 5 minutes. We'll do it that way, and then a lot of times I'll turn them over, and we'll do it face down. There's another spot in the back of the neck.
Okay.
Somebody I tested Saturday, she had shoulder and arm pain that radiated down the side of her body.
Okay.
She had been told by her massage therapist that it might be the way the seat of her car was and the way she was driving that was contributing to that. So she actually went out and bought a Tesla.
Wow.
Okay.
Must be nice.
And she said her shoulder regularly pops
Okay.
and clicks when she does the movement. So we did the test both directions, top and bottom. Her base pain level was a 6. That like minimum all the time, 24/7. She's at a 6.
Okay.
On 0 to 10. So we brought her from a 6 to a 3
In that first taste?
in those first 10 minutes. Yeah.
Okay.
And when she moved her shoulder, she said, it's not clicking, it's not making any popping noises.
And that's just from doing the pressure points.
Right.
You said something before we have to address that there may be some discomfort. What does that mean? Is it from the pressure?
It's from the pressure, right.
Okay.
And a number of people have said it was there in the beginning, but it went away. Okay. I'll tell them, you may feel a little bit of discomfort. Deep breathe through it.
Because you're pressing pretty hard on
Because it's not as, it's kind of a weird, you can kind of tell by feel when you've done it for a while.
Okay.
And so, and then when I use the tools, if I use the tools for both front and back, it doesn't, when they're face up, I don't need to push as hard with the tool because the tool just seems to hit that spot in a different way that my hands don't.
Yeah, I get it. Okay.
And so one of the interesting things is they say the brain fog clears.
Really?
Yeah. And that was like the first thing my wife noticed. My father, his description is the universe opens up to him when I do this.
So how many sessions on average?
So we'll do the test, the symptoms, we see the symptoms go away or we see the symptoms reduced. Based on how quickly those symptoms come back, then we'll set up a treatment plan.
Okay.
Okay, we're looking at 8 to 10 weeks total because if your meninges is used to being out of place,
Right.
we have to condition it to go back to where it belongs. And if your brain is used to manifesting that pain,
Right.
we have to condition your brain to realize that it doesn't have to manifest it anymore. The brain doesn't have to go, oh, that knee is hurt. So the body has to experience that pain all the time.
Right.
And so, like there are some people who are in severe, like wheelchair, severe pain, scooters, those sorts of things.
Yeah.
Those people probably need, in the beginning, the first week or two, need 2 to 3 applications a day.
Oh, wow.
Because they've got big issues.
Okay.
Okay. And if somebody I tested a few weeks ago, her symptoms can come back for 2 days. So the plan for her was 3 times a week for the first couple weeks and then twice a week for the last 6 weeks.
And then after
And
that,
that's probably enough.
after that period is over, are they done?
Typically, yes. So that's sort of phase 1. I look at the functional medicine side. I like to do a dry blood test which is a finger prick basically on a special card that we mail into the lab to look for inflammation markers in the body.
Okay.
And then a dry blood test to look at gut biome issues because your whole immune system starts in the gut biome and a lot of inflammation issues. And I was just reading a new study that shows that a lot of fibromyalgia issues may even start with the gut biome.
Really?
Okay. And so if we can look at the hardware of your body, the software of the cells with the inflammation, because if we can, and then the firewall of your gut biome.
Okay.
We put those 3 things together. There's a lot of people out there who have chronic pain, chronic inflammation, fibromyalgia, other issues like that, and their physician has told them there's really nothing you can do about it. You're just going to have to learn to live with it. This is your new normal. Maybe here's a pill.
Right.
Those are the people who come to me, and about 8 out of 10 times we can get them relief.